Injections. Please note, students may leave the same pair of gloves on throughout all 3 injections. If student has already washed hands and put on gloves, they do not need to re-wash. Students must verbalize. Injections may be completed in any order. Injections. Intradermal. Step 1, washed hands. Step 2, identified patient using at least 2 identifiers. Items 3 through 5 can be done in any order. Step 3, prepared all equipment. Step 4, put on gloves. If student completed any of the other injection types and was wearing gloves, they may continue wearing the original pair. Step 5, student stated needle length and gauge ranges for intradermal injections.
For an intradermal injection, I am going to need a needle that is 3/8 to 5/8 inches in length and between 25 and 27 gauge.
Items 6 through 7 can be done in any order. Step 6, found and cleaned an appropriate ejection site with 1 alcohol wipe in a concentric circle motion moving outwards. Allowed alcohol to dry. Step 7, opened vial and cleaned with an alcohol pad. Step 8, withdrew correct volume of medication, 0.1 cc, and removed air from syringe. It is helpful to first inject 0.1 cc air into the vial, then draw up the medication. Step 9, inserted needle superficially with bevel side up at a 15-degree angle. Step 10, entered just under the epidermis and injected 0.1 cc of fluid to form a bubble under the skin. Note, depending on the condition of the task trainer, a bubble may or may not form. Step 11, removed needle using a 2x2 gauze pad without applying pressure. Items 12 through 14 can be done in any order. Step 12, disposed of supplies safely and appropriately. Step 13, student stated,
The patient should return in between 48 and 72 hours to have the test read.
ID injections are most often used for a TB test. Step 14, student stated,
I would now document in the patient's chart the date, the time, the needle gauge, the location of the injection, whether there were any complications, and any instructions that I gave.
Injections, subcutaneous. Step 15, washed hands. Step 16, identified patient using at least 2 identifiers. Items 17 through 19 can be done in any order. Step 17, prepared all equipment. Step 18, put on gloves. If student completed any of the other injection types and was wearing gloves, they may continue wearing the original pair. Step 19, stated needle length and gauge ranges for subcutaneous injections.
I need a needle that is 1/2 to 1 inches in length and between 22 and 24 gauge.
Items 20 through 21 can be done in any order. Step 20, found and cleaned an appropriate ejection site with 1 alcohol wipe in a concentric circle motion moving outwards. Allowed alcohol to dry. Step 21, opened vial and cleaned with an alcohol pad. Step 22, withdrew correct volume of medication, 0.3 cc, and removed air from syringe. It is helpful to inject 0.3 cc air into the vial, then draw up the medication. Step 23. Held tissue gently between thumb and forefinger to raise subcutaneous tissue above the muscle. Step 24. Inserted needle at a 45-degree angle and injected fluid. Step 25. Removed needle syringe using a 2x2 gauze pad with slight pressure. Items 26 through 29 can be done in any order. Step 26. Disposed of supply safely and appropriately. Step 27. Placed Band-Aid on site. Step 28. Student stated.
I would give the patient instructions to check for signs of infection.
Step 29. Student stated.
I would now document in the patient's chart the date, the time, the needle gauge, the location of the injection site, any complications, and any follow-up instructions that were given.
Injections. Intramuscular. Step 30. Washed hands. Step 31. Identified patient using at least 2 identifiers. Items 32 through 34 can be done in any order. Step 32. Prepared all equipment. Step 33. Put on gloves. If student completed any of the other injection types and was wearing gloves, they may continue wearing the original pair. Step 34. Stated needle length and gauge ranges for intramuscular injections.
The needle needs to be 1 inch or larger in length and at least 20 gauge.
Note, a 22 gauge needle may be used for testing to preserve the life of the task trainer. Items 35 through 36 can be done in any order. Step 35. Bound and cleaned an appropriate ejection site with 1 alcohol wipe in a concentric circular motion moving outwards. Allowed alcohol to dry. Step 36. Opened vial and cleaned with an alcohol pad. Step 37. Withdrew correct volume of medication, 0.5 cc's, and removed air from syringe. It is helpful to first inject 0.5 cc's of air into the vial, then draw up the medication. Step 38. Held skin taut with thumb and forefinger to compress subcutaneous tissue and ensured needle entered muscle. Step 39. Inserted needle at a 90-degree angle. Step 40. Drew back slightly on plunger to ensure needle was not in a blood vessel, then injected fluid. Step 41. Removed needle using a 2x2 gauze and applied slight pressure. Items 42 through 45 can be done in any order. Step 42. Disposed of supplies safely and appropriately. Step 43. Place Band-Aid on site. Step 44. Student stated.
I would give the patient instructions to check for signs and symptoms of infection.
Step 45, student stated.
I would now document in the patient's chart the date, the time, the needle gauge, the location of the injection, any complications, and any follow-up instructions given.